Good afternoon. My name is Alonzo. I am in my second and final year / final term of the Masters in Public Health Practice program here at Oregon State University. And so, really quick intro. I live with my wife and Canby with our two cats, Bam Bam and Russer. One of them is a. It's got a combination of colors, like brown, black, orange, white, a whole combo of colors. He's Tabby. And then we have an orange tabby, and that would be Russer. And so they are both 1 and 2 years old, respectively. So Russer's 1 and Bam Bam's 2. So, and anyways, and so, and also, I'm a community resource specialist here at Providence Health and Services, serving St. Vincent here, close to Beaverton and in the Washington County area. While also serving East Portland as well as Yamhill County. That's where I mainly work, over in Newburgh. And so, helping families specifically with children with intellectual disabilities, but here we serve all families from all walks of life, serving families with children from 0 to 21. So yeah, and let's get into it. So why am I taking this class? So, I mean, I've always been curious. I mean, from at least from an environmental and occupational health standpoint of how toxicology comes together and how it plays a role in looking at our public health policies as it relates to environmental and occupational health. And even though it's not in my expertise, I've always been curious about it, just because, naturally I love science. So I'm always curious to learn something new, and also as it relates to health policy, and also public health from a safety point of view. And so what I am hoping to learn, as I mentioned, I'm kind of hoping to learn how it fits into how we look at public health policy, as well as how we combine the, how do I say this, like when we look to combine the promotion of health safety, and how toxicology combines in that. And so I'm hoping to learn a little more about that, as well as the concepts that are going to be brought up in this class. And so one example of something toxic from my own experiences. Well, I'm going to have to dive really deep here, because before my role here at Providence, I was a hospital corpsman in the United States Navy for 5 years. And I enlisted when I was 18 back in 2010, and then finished out my career in 2015, serving at 2 duty stations. So my first being in Rhode Island with the Naval War College, and then secondly with 1st Medical Battalion over at Camp Pendleton in California. And so in terms of toxic substances, I've come through quite a bit, at least in my role as a hospital corpsman over there, specifically in California. So whether that's asbestos, we don't want to disturb the asbestos in some of the buildings that we were in, and so we made sure not to disturb the asbestos in the buildings. We also learned about treating water if we are going out for a field exercise, or if we're out in country, how to properly make water potable. And so that includes the use of iodine as well, and also water testing, just to make sure that nothing toxic is in the water. And so let's see, what else? So as part of our training, we were exposed to, I forgot what the gas is called, but we were exposed to that as part of our hazardous training. I guess it's hard for me to describe, just because I don't know. I don't. It's been a long time, and I don't really know the logistics of it. But that was also part of our training. They called it I don't know if it's appropriate for academia here. So, but we were basically trained on how to properly use our gas masks, in the event that we were exposed to a highly toxic substance. And so, so that was that was one of the toxic substances that we were exposed to. It was like the same substance that's used in pepper spray. So, so there's that. One new thing that I learned from the toxicology module, and so apologies everybody, I had a family come in. So what was interesting, at least looking at the history of public health toxicology, was noting that hemlock even until this day still has no antidote for it. And even though that was used as a method of execution back in the era of Socrates. And so I'm curious because, like, you know, with the advancement of medicine and the advancement of different antidotes that are available for different toxic substances that we may be exposed to, it's really interesting to note that we still don't have an antidote for hemlock. And so yeah, that was actually really curious. That was actually really curious and interesting to learn. So thank you all. I am looking forward to collaborating with you all this term.